COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. The size of SARS-CoV-2 virions are approximately 50 to 200 nanometers in diameter, and its genome is single-strand positive sense RNA. Wuhan beta coronavirus sequence shows similarities to beta coronavirus found in bats, but they are genetically distinct from other coronaviruses such as SARS-CoV and MERS-CoV. Past experience, like the Middle East respiratory syndrome, pandemic influenza, and other outbreakers, has shown that as an epidemic evolves, we face an urgent need to expand public health activities in order to elucidate the epidemiology of the novel virus and characterize its potential impact. The impact of an epidemic depends on the number of persons infected, the infection transmissibility, and the spectrum of clinical severity. Early COVID-19 cases were linked to a live animal market in Wuhan, China, suggesting that the virus was initially transmitted from animals to humans. It appears more transmissible than SARS, and the spread is probably more similar to influenza. Asymptomatic and pre-symptomatic patients can transmit the virus. On January 21, the US CDC reported the first confirmed case in the region of the Americas. The patient has a history of travel to Wuhan, China. On January 24, the French Ministry of Solidarity and Health confirmed 3 cases in the country, being the first reported in the European region. On January 30, the COVID-19 epidemic was declared by the World Health Organization as a public health emergency of international importance. Brazil Ministry of Health on February 26 confirmed the first case of coronavirus in São Paulo, in a male with a history of travel to Lombardy, Italy. Almost at the end of February, 81,109 confirmed cases of COVID-19 and 2,762 deaths were confirmed worldwide, with an overall fatality rate of 3.41% and a proportion of severe cases of 11.19%. On February 28, the first case was confirmed in Mexico, in a 35-year-old male in Mexico City, who had a history of traveling to Italy. On March 15, Mexico already has 41 confirmed cases, all with a history of travel to countries such as Italy, the United States, Spain, and Germany. On April 5, 2,143 cases of COVID-19 have been confirmed in the country, and 94 deaths have been reported. On May 12, 38,324 cases of COVID-19 were confirmed in the country, and 3,926 deaths were reported. Currently, Mexico confirmed more than 59,000 cases and more than 6,500 deaths from COVID-19.
The pathophysiology is not yet completely known. Coronavirus is invading respiratory tract via the nose. After an incubation period of about 3 days, they cause the symptoms of common cold, including nasal obstruction, sneeze, runny nose, and occasionally cough.
Hi, I'm COVID-19. Do you want to see what can I do? First, I hope you have paid attention to your classes. Okay, once the incubation has elapsed, thousands of us are released, and that's when our games begin. First up, your larynx, and after that nobody can stop us. We keep going down the trachea until we reach the carina. Once there, we choose between the 2 main bronchioles to go. Once there, each one takes his way through the different bronchi until he reaches the alveoli. And it is at that moment when we cause an accelerated cell death and your body as a defense method begins an inflammation. This inflammatory response produces substance that can damage the lung itself if it's very high. It generates cell edema that makes it difficult for oxygen to cross the thin wall of the alveoli and reach the blood. But it causes irritation and fever, and if the infection spreads in the lungs, that's when pneumonia starts. For this moment, we have already invaded the blood system, and it's easy for us to invade another systems and organs.
The virus binds to the host cells its genetic material. Each virus is very specific and only infects a certain type of cells. In the case of coronavirus, it binds to the protein ECA2, which is present in various tissues, particularly in the oral mucosa, considered the main route of entry to the organism. After entering, the body looks for how to adhere. In this case, managed to have compatibility with the ACE2. It is highly expressed in the alveolar cells of the lung, as well as in heart, kidney, and bowel cells. In the case of pneumocytes, it adheres to the ECA2 receptors and begins its adaptation on the surface of the cell membrane to replicate. The genetic material is free in the cytoplasm, and already within the cytoplasm begin the replication of RNA. When the cell is already full of RNA copies, the exocytosis mechanism of these proteins begins outside to the cell and affects the other systems such as nervous system.
The presence of neurological symptoms is low. Results were found that were associated with axial lesions similar to Guillain-Barré syndrome. 3 patients present demyelinaceous processes magnetic resonance imaging with gadolinium was performed, which showed alteration in the nerve fibers, which contrasted with the well-known Guillain-Barré clinic. These are the standard drugs used in Mexico. Enoxaparin. It is a low-molecular weight heparin that inhibits antithrombin 3 and factor XA. It is the current treatment to prevent intravascular coagulation. Hydroxychloroquine, anti-malaria drug that has given good results in the treatment of lupus, arthritis and rheumatoid arthritis, and is seen to be useful for COVID-19. It was found that its main adverse effect is prolonged QT, and its use reserved for certain patients. Ivermectin, it is observed that it inhibits viral replication and is generally used as an antiparasite. Azithromycin. Efficacy has been observed in the treatment of COVID-19 and is part of the family of macrolides. Well, now we'll talk about some prevention. When coughing or sneezing, cover the nose and mouth completely with disposable tissue or with the internal angle of the arm. In case of illness, it is recommended to use a coverlet changing for new one every 3 hours. Cleaning and disinfecting surfaces and objects commonly used. Avoid greeting by hand, kiss, or hug. Wash your hands frequently with soap and water. Facial protections consist of medical mask accompanied by a visor of safety glasses or facial screen clean gloves. Hand washing steps according to the World Health Organization. 1. Rub the palm of your right hand against the back of your left hand, interlocking your fingers and vice versa. 2. Surround the left thumb with the palm of your right hand. Rub with a rotating motion and vice versa. 3. Dry them with a single-use towel. 4. Apply no soap to cover all the surfaces of your hands. 5. Rub the palms of your hands together, with your fingers entwined. 6. Rub the fingertips of your right hand against the palm of your left hand, making a rotation motion and vice versa. 7. Use the towel to turn off the faucet. 8. Rinse your hands. 9. Your hands are safe. 10. Duration of watching between 40 and 60 seconds. Currently, quarantine and isolation measures are being applied in attempt to limit the local, regional, and global spread of this outbreak. Strict adherence to these measures has been successful at controlling the spread infection in these select areas.